Programme is Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public. Hello, Doctor. Thanks for joining me.
Hello, Vanessa. Hi.
I mean, I hope you don't think that my introduction was kind of too full of gloom and doom and wretchedness and kind of awful resignation. And, you know, I hope you don't think that that example was an unfair example. I was trying actually to paint an accurate picture rather than a frightening picture.
It is accurate. I don't object to that whatsoever. That we need the truth. 414 deaths per week on average over the whole period from September to November, up to the statistics available, have been dying on the emergency pathway because of delayed treatment.
Can I interrupt you to let you explain to my audience, the viewers and the listeners, how and why these people die, how and why they become what's known as excess deaths, which means they shouldn't have died, they should be alive. Why are they dead? What kinds of things have happened or indeed not happened that have meant that these people have died rather than surviving?
Well, there are people who are having emergency events, whether it's a heart attack, for example, or they're bleeding, or that they've had a stroke, all sorts of life-threatening events, including diabetic comas or the lead up to those things, sepsis, and we know that in the general scheme of things, the ambulances would get to type 1 emergencies within 8 minutes, that's the standard, and type 2 emergencies within 18 minutes, and that's just not happening. So there's a huge delay in care in people's homes, and then they're in the ambulance, and there's a huge delay in the ambulance because they can't get into A&E, and there's a huge delay in A&E because they can't get to the ward if they need to be admitted. So that those huge delays are cumulative, and any delay over 4 to 6 to 8 hours adds the risk of dying. Now, what I want to emphasise is I think the NHS is absolutely in crisis, but that's a set of symptoms, life-threatening symptoms, and it's not the cause. So we need to ask ourselves, what is the cause?
Right.
The NHS has had crises in the past, but and the funding and support for the NHS has fluctuated over the decades since it was put in place in 1948, and those have been very significant fluctuations. But when the NHS was funded very well, up to the average of the bigger economies in Europe by 2008, 9 and 10, these crises were not happening. 90% of people were going to the A&E, for example, and were treated and either discharged or admitted to the ward within 4 hours, 90%.
Right.
And 90% of referrals of patients, for example, the cancer pathway or anything else, to specialists, 95% were seen and treated within 18 weeks. They didn't have staff shortages, they didn't have staff burnout, and that was the result of government funding for the NHS over the period up to 2009, before the world crisis. And that benefit of well-staffed, well-supported, well-paid, relatively well-paid NHS staff, that impact lasted beyond the change of government in 2010, because it took several years before the austerity imposed on public services began to hit the NHS, and it was. And I have the benefit of actually working in the NHS, Vanessa, during that time. You know, I was a consultant.
And when you did, and when you were during that time, to make this conversation vivid so that people can imagine, and rather than, just a kind of chronological depiction of the factors you see, it would be much more, I suppose, impactful if you would say you were working there as a consultant at the time. What were the sort of changes that you noticed when, as you say, austerity hit the NHS? What did you see or not see? What was happening or not happening at that time?
Well, I was Director of Children's Services there. I'm speaking now on this platform with you as the chair of Keep Our NHS Public, desperately trying to raise awareness that a publicly funded NHS has actually been the best health service in the whole world by world acclaim. But when I was a consultant and Director of Children's Services across hospital and community in South East London, one of the incredible impacts was that my job as the clinical lead changed from trying to improve services as my major priority to saving money and being told to cut NHS paediatric children's services budgets by 3% a year. And I was ending up spending half a day, or even 2 days a week sometimes in meetings about how to save money and how to formulate a contract that would be protecting our services against competitive bids from other services.
Let's come back to that in a minute, if you wouldn't mind. But I hope you'll listen to my caller with me and then see how you respond to what he has to say. And this caller is very familiar to me because he used to phone me at the BBC, so I know him of old, although we've never had the pleasure of meeting face to face. And it's the very lovely Lenny from Ashford. Hi, Lenny. Good afternoon to you, my darling.
Good afternoon, Vanessa. Well, I wanted to tell you about two of my friends.
Yes.
But the one in Ashford, he's 92 years of age. Mm-hmm. He collapsed at home. He was waiting 8 hours for an ambulance and then spent 3 days in a corridor before he was admitted to a ward.
And that's the age of 92, and that's local to you in Ashford. And were you there while he was waiting some of the 8 hours? I mean, how did you know what was going on with this gentleman?
Well, I'm very, he's a friend of mine of 50 years. Right. I'm very close to the family, and I'm going by what his daughter has told me.
Gosh, and what would you like to say about it, Lenny? I mean, obviously you've got deep feelings about this. This is your friend, as you say, of 50 years, 92 years old, in a hospital corridor for 3 days after waiting 8 hours for an ambulance. And none of this is remotely satisfactory, is it?
I would like to tell you the total difference of a friend of mine in Spain who's nearly 80. Mm-hmm. He collapsed in Avia Golf Course on Monday. Yeah. Within 1 hour, he was in Denia Hospital, which is just over an hour away, a half-hour away drive, sorry. Mm. And within that hour, he had seen a doctor. Within 3 hours, he'd seen 5 doctors and had tests. And within 4 hours, he was in a cardiac ward.
Okay, well, thank you for telling the story, Lenny. Let's talk to Dr. Tony O'Sullivan and just see. Obviously, we don't really need a thesis about the difference between us and Spain, but if you want to say why you think the service in Spain, Dr. O'Sullivan, was so much better, you certainly can. But let's start with this 92-year-old gentleman who is waiting 8 hours at home to be picked up by an ambulance, then 3 days in a corridor. I mean, what would you say about that?
Well, yes, I mean, you've got the strapline for a period of time on this programme, the NHS is broken. Mm. And what I'm saying is we need to ask why is the NHS broken? And that's just a terrible story. An elderly man waiting 3 days before access to a ward. But the answer is that we don't have enough beds, not enough doctors, not enough nurses, but primarily at the moment, not the only thing, but primarily at the moment, the social care system is a disgrace and is utterly broken.
Just sorry to interrupt you, but only the other day, one of our experts on the programme said, you know, that the people who work in the care sector are earning just over £9 an hour, and very recently, if you go and work at Sainsbury's, it's over £11 an hour. So why wouldn't you want to do something and stack shelves and not feel responsible for somebody else's, living or dying? Why wouldn't you take the far easier and less worrying job at Sainsbury's and get more money and be happier? Why on earth wouldn't you?
Yes, and especially as hundreds and hundreds of those carers died during COVID.
Exactly.
Extremely unprotected. And then they get really abused with no pay rise. Now, I think we need some kind of set of proposals that offer a way forward. And for me, The first thing is for the government to admit that there really is a national crisis, to declare it. How can it not be a national crisis if the equivalent of 2 jumbo jets crashing every week and killing 500 people, you know, if that were happening, that would be an absolute emergency and all hell would break loose and there'd be a COBRA meeting. The government should be convening meetings with health leaders, clinical leaders who know what they're talking about, trade union leaders who know what their members are experiencing, social care leaders and local authority leaders, and find out urgently what can be done. They should pay the staff in the NHS immediately what they are worth and stabilise the hemorrhaging, stop the hemorrhaging of staff out of the NHS. You know, 40,000 nurses left the NHS in the last year. Morale is rock bottom. And it's not because they're greedy, it's because they're being abused. You know, there's a 25% of NHS trusts have been forced to set up food banks. I know you know this, we've heard it before, but it's true.
Okay, final question, because I have to finish, I'm afraid. Final question. Do you think these strikes will make any difference?
I think they have made a difference already. And I would say that they agonised over going on strike. And it was an absolute last resort where they were actually saying, if you weigh up the pros and cons, if they don't go on strike, the government will completely continue to let the NHS and the population down. So it's forced Steve Barclay to meet them on Monday and to meet the BMA, I think, yesterday or the day before. And there's a leak now, which I'm sure was a deliberate leak, to say that he's now recognising in private that the NHS staff, millions of them, deserve more money.
Dr. Tony O'Sullivan, thank you very much indeed for your time and thank you for joining me. And lovely listener, vibrant viewer, do get